Hello, everyone, and welcome to today's International Nursing Webinar Series. My name is Jerome Babate, and I'll be your host and moderator. I am originally based in the Philippines, but in the last 6 years in Sydney, Australia, and I'm excited to be hosting this webinar. I have a few housekeeping items to cover about this presentation and the webinar platform. First, today's webinar will be available after the live session and is accessible on YouTube via the Bethany Delta Nursing Society channel. I have you muted to avoid background noise. Nevertheless, you can unmute yourself during the Q&A session. You can use the chat button at the lower section to ask questions, and I will read it for you. Next, we'd love to hear from you today's presentation. Our colleagues will be joining us as panel reactors. And last, we'd like to encourage you to share today's webinar with your social networks, Facebook, LinkedIn, TikTok, or Instagram if you would like. We have started this International Nursing Webinar Series on the latter part of 2019. This webinar is an opportunity for Southeast Asian nurses to build relationships and to disseminate their nursing and health-related knowledge. This webinar is organized by Nursing for Humanity in partnership with Bethany Delta Nursing Society. The main objectives of the International Nursing Webinar are to demonstrate and advance the nursing contribution of Southeast Asian nurses. Second, to support nursing contribution to the region's healthcare and to encourage problem-solving approaches to health priority needs. And lastly, to provide opportunities for in-depth exchange of experience and expertise within and beyond the international nursing community. For older people with long-term conditions, structured activities within a community setting are thought to improve well-being and quality of life. There's little known about the outcomes of daycare provision for older people with long-term conditions in an Asian and Filipino nursing context. Our webinar speaker today is Professor Pearl Cuevas. Professor Cuevas conducted a doctoral research project that aimed to develop a model for a nurse-managed adult daycare program for older adults to guide nurses in creating meaningful, focused, and structured activities. Dr. Pearl Cuevas is a nurse, researcher, mentor, professor, and lifelong learner. She graduated with a degree of philosophy in nursing at the University of the Philippines, Manila in 2014. Then she pursued a postdoctoral fellowship at the Gerontology Nursing Leadership Academy of Sigma Theta Tau International Honor Society of Nursing in Indiana, USA from 2016 to 2017. She's the first Filipina and the only Asian in the academy. In 2019, Dr. Cuevas became an international visiting scholar at the Center for Global Initiatives, Johns Hopkins University School of Nursing in Baltimore, Maryland, USA. She is currently an associate professor at Centro Escolar University in Manila, Philippines, teaching in the School of Nursing and the Graduate School. In pursuit of lifelong learning, she is currently writing her thesis for the degree Master of Science in Medical Anthropology from the College of Medicine at the University of the Philippines, Manila. So without any further hesitation, I'd like to kick things by welcoming Dr. Cuevas.
Under the supervision of qualified personnel to care for them and in a safe environment. The program is beneficial because it addresses the socialization needs of the older persons and alleviates the burden of caregivers. In an adult daycare program, family members feel secure that older persons are being cared for while they are at work. It is my assumption that nurses are in the best position to manage these services for older adults, and that is what prompted me to do this study. Okay, so this is the conceptual framework. No, I had a framework for this study, and it is towards the development of a nursing model for adult daycare. Model development have three phases, namely conceptualization, integration, and assimilation. Very similar to theory development, the meta paradigm of person, nursing, health, and environment is shown in the model through the nursing process, which includes assessment, planning, implementation, and evaluation. During the assessment phase, Profiling and quality of life assessment was done, and the perception of older person and the services at the drop-in center for senior citizens was generated. Planning includes training module development, meaning based nursing care, training of registered nurses, and referral for an interdisciplinary team collaboration meetings and consultations was done. So actually, this is a very rigorous process. And there are actually 4 phases that I did when I was doing my study. In implementation, this consisted of nursing interventions through the description of nurses in the study, their activity plans, and the pilot program implementation. It was implemented in Bahay Kalinga, which is a drop-in center for senior citizens in Manila, Philippines. The evaluation was in the form of process evaluation of the adult daycare program, including the response of nurses to the health needs of older persons, the running evaluation of nurses, the perception of older persons on a nurse-managed program, and finally, the quality of life reassessment and comparison of results. The research took several steps to be able to generate a nursing model, and that is the contribution of this research to nursing knowledge. So before the program, we actually realized that in the sunset of their lives, they are in the pursuit of happiness, meaning they will do what makes them happy. As humans, despite wrinkles and graying hair, they want to maintain human dignity and self-worth, meaning older persons want to be valued for what they can still contribute to society. Their third realization is wanting to belong to a second home. And this really struck me to be quite peculiar. It seems to me that they are not getting the sense of belonging that they long for in their first home. And this is the reason why the adult daycare is important. It will fill in this void. In planning for the program, we developed a training module to tailor-made structured activities during the program implementation. So the word is structured. It has goals and objectives, and everything has meaning for the older person. Later, the program was implemented by registered nurses recruited to run the study for 1 month at the Senior Citizen Center in Manila, Philippines. Also, when planning, we actually integrated meaning-based nursing care. For those of you who heard this for the first time, this is actually a concept I developed when I was doing my PhD, and it's about giving respect to the dignity of the personhood of the older adults. The nurses in the study were trained to structure the programs in adult daycare, and they made and presented their activity plans for the actual implementation. Nursing interventions are made through structured activity plans that are focused and goal-oriented. It aims to maintain the physical, psychosocial, and spiritual integrity of the older adults. It is holistic in approach. During the pilot implementation, it lasted for the whole month of January and has 12 program sessions. The highlight is the performance of the structured activity plans created by the nurses in the study for the sessions. For you to be able to see what it was like, here are a few pictures of the activities. Every day, they had 10-minute range of motion exercises just to keep them going throughout the day, to start with the program. Then they had art therapy, and they do sharing of their artworks. They did this to get to know the participants better, and the drawings are very insightful of how they truly feel. We also had movie time. It's for slow time, like after lunch when they do their siesta. And the movies we show are actually a realization to the older adults and also an additional learning experience for them. We actually showed them movies related to older person, like the movies of Markova or the movies, the Seven Sundays, and it was very well appreciated because they're going through this life encounters. Also, we invited a physical therapist in one of our sessions, and the participants had a demo of physical therapy, and they did the return demonstration. This is a testimony that interprofessional team collaboration will actually benefit the program. So during the course of the program, we bring in a lot of interprofessional workers to help us holistically deal with the problems or concerns of the older persons and that are participants in the study. We also had a cooking class wherein we taught the older persons on how to prepare nutritious meals that that they can cook at home for their families, and also some of them opted to make it a business, and sell these nutritious dishes that we have cooked during our cooking classes. We also had a first aid training to equip the older adults with knowledge during emergency situations. They actually liked this very much because they wanted to be able to help each other during emergency situations. Well, ballroom dancing is a favorite activity of the older persons. They made it, in fact, a fundraiser for the center, and they even hired some dance instructors for these activities. I do appreciate this because majority of them have fun and they exercise using their dance steps. So one of the most favorite activities is also line dancing. In line dancing, this is usually headed by the nurses, and the nurses also get to exercise themselves. It's a very popular group activity and a good way to enjoy and still stay fit. The nurses enjoy just as much with the older persons in this picture. We also had several games during the program implementation. We did Scrabble, crossword puzzles, and other word games. But the Pinoy Henyo, or Filipino genius, it is a good way to help sharpen their memory and prevent cognitive decline. And since majority of the participants are financially challenged, security in old age is really a major concern for older persons. They actually requested us to have a livelihood activity that is within their means. So we can help. We got help from an NGO or a non-government organization that taught them to crochet plastic and turn them into bags. And all this crocheted plastics was sold for export. And then the money was given to the senior center, to provide hot meals for the older persons who are attending the activities in the senior centers. So this is a very cute picture where the older persons participated in a talent show wherein they showcased their singing and dancing and declamation talents and enjoyed a friendly competition. It's also a good way for them to reminisce about their past, using their Filipinianas and their barongs and their Americanas. It's a good way to remember how they were when they were younger. We also organized a hospital tour and brought them to the National Center for Geriatric Health, which is a hospital for older persons. This is to orient them to a hospital that is dedicated to address their needs. A realization for me is that not majority of our older persons know that there really is such a hospital that is dedicated for older person care. Every end of the session day, they enjoy group singing, and they really like joining videoke singing as well. So another eye-opener for me is the role of music as a therapeutic intervention for older persons. It brings back good memories and leaves a feel-good leaves as a feel-good activity for them. Aside from that, they do like spiritual activities like Bible sharing. And so we have Bible sharing every day, and it's very well participated by the older adults, sharing their stories and lessons they learned from life. And it has become a very enriching experience for the nurses as well. We also had one recollection session as a way to come to terms with their spiritual beings at the sunset of their lives. So these are the activities that they really enjoyed, wanted, and participated so much in. So what was the result of the interview with the nurses after we're done with the pilot implementation? The nurses interview are an eye-opener for young nurses on what it is like to be old and poor. This motivated them to manage a more holistic program for the participants, and the nurses also realized that managing the program is intertwined with other roles, that of a health advocate, a spiritual advisor, a consultant, and also a researcher. Results from the interview with the older persons showed gratitude for the nurses' time and effort in the program sessions. They realized the need to strengthen not just their physical body, but also every aspect of their lives. The older adults confirmed that the session has given them a renewed appreciation of life after retirement. This finding was supported by the results of the Quality of Life questionnaire, which showed a significant increase in the p-value of the participants after the implementation of the adult daycare program sessions. The increase is in all domains, namely the physical, psychosocial, environmental, and their overall quality of life. The results of the quality of life in comparison after the program was implemented, the psychological domain achieved the highest rating, which means the adult daycare program has cognitively stimulating activities in the session that helps decrease cognitive decline. So a nursing model was developed from the findings of this study. The nursing model showed the nurse, the adult daycare program, and the older adults within a caring context that explores, respects, and nurtures their interconnectedness. So this is the diagram of the program. There are 3 circles. The 3 circles are processes that demonstrate the ever-changing, dynamic, and cyclical nature of knowing and nursing. The nurse is shown here as an educator, a manager, and a practitioner. Juggling these 3 roles are major in managing the program. The program of implementing meaning-based adult daycare sessions are structured from the assessment of findings, planning the data, program implementation, and evaluation. The older person's dynamics include being family-oriented, meaning they will seek income-generating activities to provide for their family, even if they are in a precarious economic situation. They're also spiritual and religious beings that rely on God's provision for them. Despite the many challenges, they also enjoy selfless acts like volunteering. They show camaraderie with other senior citizens, and they look after each other. They are also eager to learn and participate in the program while maintaining a reciprocal relationship with the nurse. In conclusion, nurses are in the best position to manage an adult daycare program for older adults. Primarily, it is because nurses address the meaning of situations to older adults and base our nursing interventions on it. The nurse is an advocate conveying genuine concern, give holistic care, tailor-fit care plans to individual needs, consider safety and security of the participants in promoting wellness and preventing degenerative changes in them. The nurse becomes the embodiment of care rendered, showing the Filipino trait called malasakit, which is about going the extra mile to deliver care because they treat them like their own family member. As a recommendation, we recommend an audience with policymakers who can mandate the provision of adult daycare services in senior centers in the country. With this, the training of nurses and adult daycare services is recommended as a subspecialty for gerontology nurses. In the near future, it is also recommended that adult daycare programs and services in senior centers be eventually subsidized by the government through PhilHealth. We also recommend the support and collaboration of an interdisciplinary team to make the program more successful. Researchers might also want to look into the effects and sustainability of the program when it runs on a long-term basis. In summary, the nursing model developed adds to the knowledge base in nursing science. It shows the evolving role of the nurse in the healthcare setting. It showcased nursing innovation and creativity to deliver care and measurable outcomes for older adults. With this, thank you for your time and attention. Again, good afternoon, and I'm ready for your questions.
Thank you very much, Dr. Cuevas. Before we go ahead and take some time for questions, I would like to invite our panel reactors for a rejoinder. We got two panel reactors here, Professor Joel Estacio and Dr. Kenneth Beluya. Dr. Kenneth Beluya.
Yes, Doc Jerome.
Yeah. Jerome na lang.
Good afternoon.
Yeah. Are you ready for the rejoinder?
Jerome, thank you for inviting me.
Yes.
Shall I start, Doc?
Yes, please.
Thank you and congratulations, Dr. Cuevas, for that very comprehensive presentation. I know that most of our audience have grasped a clear understanding of how our elderly should be cared for. I have noticed that the age group of your participants or nurse participants on this study range from 21 to 28 years of age, meaning they are the young generation nurses. Taking into consideration that the elderly or the resident subjects have already experienced being cared for in the elderly facility, how do they compare or do they have any comparison or any differences in the management of care that the young nurses implement as to the previous care management that they are receiving?
Okay. The nurses in the study are actually recruited for the study, and they applied to be a part of this study because they're mainly interested in gerontology care. The centers cater for health promotion and disease prevention, so therefore all activities are towards that. And for example, the hospital-based, so the National Center for Geriatric Health, is all about the curative and the rehabilitative aspect of gerontology care, leading towards geriatric care. So majority of the participants go to the senior centers every day to maintain a healthy lifestyle and also to promote their wellness. But when they get sick, they are cared for by nurses in the hospital for their geriatric symptoms. So majority of those who go there are with chronic diseases like hypertension, diabetes, also dementia and Alzheimer's related symptoms. So the difference between the nurses in the senior centers, they are community-based nurses, and majority of their roles are related to health education and teaching the older persons on how to maintain their well-being, while nurses employed in the hospital setting are more towards curative and rehabilitative care and also maintaining daily functioning of the older persons.
Yes, thank you, Dr. Cuevas. My follow-up question for your answer is, uh, does the elderly find any differences on the management that the nurse subjects have employed to them as compared to the previous management that they are receiving? Do they have encountered in the past, Pinoy talent expositions, and like that you have employed in your study?
Actually, my study was the first to use activities in adult daycare. There are very few nurses who has ventured into the health promotive aspect of gerontology nursing. Majority of gerontology nurses are geared towards um, the curative and rehabilitative aspect, meaning pain management, symptom control, palliative and end-of-life care. So I think that was one of the major differences. Um, the participants in the study actually said that the it is their first time to have nurses really who are um, looking after health promotive aspects and making them healthy so that they don't have to go to the hospital. So the answer is actually this is the first time, and I have not heard of any researches that have followed from this paper as of now.
So based on the pictures that you have shown, it is clearly and vividly showing that the elderly have liked and positively accepted those management. And I would like to congratulate you and your nurse subjects for employing that type of activities to the elderly. One last question, Dr. Cuevas. As an educator, do you recommend the findings of this study to be incorporated in the present nursing curriculum? In which course offering will it be best suited to tackle or to discuss?
Um, yes, I would like to recommend this to be a part of gerontology nursing. On the first part, wherein we have health promotive and disease preventive interventions, I think an adult daycare program is necessary to maintain the well-being of older persons, so that to um, we don't have to put so much budget on um, curative and the rehabilitative aspect or hospitalized older person. We can actually cut a lot of the budget that we use if our older persons are healthier and not put the budget on the maintaining their health while they're already sick. Also, I thank you for the very good comments, but I just want also the audience to realize that my participants come from the lower socioeconomic status. So the findings actually reflect older persons who are from the poor sector of society. So therefore, they really need to um, they really need to take care of themselves because they don't have the means to um, to go to the hospitals and pay for their bills once they get sick. And also, um, some of them are breadwinners still of their families, and they needed to provide for them. And that is the reason why they appreciate these activities, because it is also a means for them to continue with some livelihood projects so that they will earn money and provide for their families.
But maybe we can also transcend the findings of this study to family members and significant others of our elderly, because as you have said, not all elderlies can be enrolled in a home care setting, and most of us Filipinos value the close family ties. So I think the findings that being gathered on your study will be significant also to family members to employ in the future.
Yes, that is a very good recommendation. Um, I think the family members should take an active role in the activities of the older persons. A lot of studies that I've read have actually told me that the Philippines is now getting ready to for adult daycare and also for home care of older adults. I had this notion before that Filipinos do not want their family members outside of their household because we have been socialized that the older persons stay with the family and remain with the family, and we're the ones who take care of them. But now we have been open to other carers or family, especially professional carers like nurses, who can give better better care and more professional care for our family members or older persons, and wherein they would benefit from activities that will make them and that will actually empower them, to well-being and prolong, their retirement life into a happy, happier existence, not disease laden or burdened with chronic conditions.
Thank you, Dr. Cuevas. That is all my thing I want to clarify. Thank you, and more
Thank you
power.
very much, Dr.
Thank you,
Biluya.
sir.
Yeah, we'll get back to you, Dr. Biluya, in a little while. Our next reactor is Professor Joel Estacio. Professor Estacio?
Yes, Dr. Babate, thank you for inviting me to be a panel reactor of this webinar. And to Dr. Cuevas, congratulations for well done dissertation paper. And
Thank you,
this is,
sir.
yes, Doc, and I think there are a lot of strengths I have seen in your study, one of which is the tailored presentation of your interventions. Another one is your emphasis on meaning-based nursing care. This is actually my first time to hear the concept, and I think that adds up to the reality that nurses have to be holistic in their care for not only older adults but to all our clients. Being holistic was also presented in your interventions. You have several activities like talent shows, dances, singing, cooking, and also one of the important strengths that you have emphasized in your study was its interprofessional or intercollaborative care. You have involved physical therapists, and I assume you also involved other members of the health team, like the barangay health workers, maybe, or the midwives, who are always at first hand in terms of delivering uh, promotive and preventive care to our clients. You have addressed several issues in terms of care for older adults. First of which is because you chose this topic, it is highly relevant not only nowadays, but because in the future we see a steady increase in the proportion of elderly population, not only in our country but in the rest of the world. The second one is the need to address national policies. In our country, we have to. It is always emphasized that our nation is not prepared to the needs of the influx of aging population, and I really think that involving nurses in terms of this area of or this particular population group is one way of addressing such situation. Another issue that you have addressed is the disparity in the access of services. Although I have seen that most of your population group is, or all of your population group came from an urban area, maybe
Yes.
for further studies, some may consider older population in rural areas because several studies have already shown or have already proven that there are disparities in terms of access to healthcare among these between these areas. There are several implications that I would like to emphasize in relation to your presentation. One of which is the increasing interest of care for older adults. Although here in the Philippines, we have the Institute on Aging by under the National Institute of Health. I really I am with you, Dr. Cuevas, in terms of um, branching out or reaching out to other areas in terms of providing this care to our elderly population. So I think this is one of the implications that your study uh, can provide. Another one is other areas of interest, like you have mentioned music therapy can be an area of interest for nurses or for researchers who are looking at effective interventions of providing promotive and preventive care for our elderly population groups. The third one may not be new for most nurses in the Philippines because we have been uh, or our nurse leaders have been mentioning about advanced practice nursing here in our country, and one of which can be gerontological nursing care. And in addition to that, as what was mentioned by the previous panel reactor, the nursing education can be an area of interest. Um, it has been shown in some studies like the one from the University of Santo Tomas in 2013. I have here their article which says that um, students who see older people as demanding in nature are less likely to pursue geriatric nursing. So several studies like this one can be an avenue of concern for those who are developing a new curriculum in terms of gerontologic nursing. And that would now lead me to one of the strengths of your study, which you emphasized on interprofessional workers or intercollaborative nursing care. In your study, you have the main uh, the main function of the nurse was to manage the interventions, to manage the program or the project that you have proposed or you have done. Um, I would like to also suggest or maybe uh, to emphasize that nurses should not only be focused on um, involving professionals, but also we have to take note that the the culture of Filipinos is that the elderly population are not always being taken care of by health workers. More often, they prefer to be taken care of by the family member. So I think we also have to involve family members in terms of planning and designing a more tailored nursing care, since it has been shown in several researches that involving family members would actually improve their own well-being. So we are targeting the health of the elderly population as well as the family members in when we include them also in our nursing care or in our projects in the future. So once again, congratulations, Dr. Cuevas, for this presentation.
Thank
Thank
you
you,
very much,
sir.
Professor Joel Estacio. Yeah, thanks for the rejoinder about two reactors. Okay, before we entertain questions from our online participants, I would like to recognize the questions put forward to me via email. Two from the Philippines and one from Indonesia. So let's start with our friends from Indonesia. We got a handful of Indonesian participants here in our webinar. So thank you for that. Big shout out to our Indonesian friends. From Suharna from Jakarta, Indonesia. Okay. Can my loved one still take medication if required while at the adult daycare center?
Yes. The answer is yes. We have included medication management while the senior citizens are in the adult daycare centers. So the relatives can actually endorse the medications to the nurse so that they can be given at the time that it needs to be taken. The adult daycare program also includes medication groups wherein senior citizens can talk about and discuss their medications, side effects, and management with a healthcare expert, making them more currently informed of their medications and their health. So thank you for that question. And of course, the answer is yes. Medication management is one of the strengths of nurses.
Okay, thank you very much. The second question, email question, is from Maria from the Philippines. What's the difference between social day programs and adult day health? Is this visible in the Philippines?
Okay, you see, Maria, our local government units have funding for senior citizens. Our local government units have different ways to disperse these funds. Some give 1,000 pesos every month for their senior citizens, while others give 1,000 every quarter. I think this is the social day program that you are referring to. It varies from LGU to LGU. Other LGUs do not give cash but give birthday cakes every year for the senior citizen's birthday. Now, the LGU also have the provision to construct a senior center from their funds. The senior center is just a social hall wherein senior citizens can commune together. There is no program at present for it. That is where the nurse-managed adult daycare program will come in. The program is a wellness program for the health promotion of senior citizens in that city. So if you're asking for the cost effectiveness, personally, I believe the social day program is a dole out. It is money that the senior citizen can use as they please, but placing senior citizens fund in an adult daycare program will actually give them more health promotion and wellness activities, which may prove to be more beneficial in the long run. The longer they remain healthy, the lesser hospitalization needs and cost they will have. So I think the adult daycare program is more cost effective and will benefit the senior citizens more.
And then finally, an email question is from Ronnie of Cebu. My family member never was one to participate in a lot of group activities. How will I get him to attend? What do I do when my loved one says that they're just fine at home alone and don't need any care?
Okay. Ronnie, research actually shows that among our Asian counterparts, Filipinos are less accepting to being an older adult. This is one of the reasons why there is relatively a small use of assistive devices among Filipino senior citizens. My assumption is that your relative has not accepted that he or she is getting older and would benefit from an adult daycare wellness program to maintain his or her health in the long run. One of the strategies you may use is to invite his friends or your other relatives to participate so that he may be enticed to join them. It may also help putting a more positive tone to adult daycare, saying that it's fun and communal and seeing it in a good way, as a good way to spend his time, might actually motivate him to join adult daycare program and stay, staying in the for a longer period of time.
Thank you very much, Dr. Cuevas. It looks like we have a question from my chat box here from Ando Pikri Hakim from Indonesia, I think.
Hello, Ando.
Yeah, and okay, sorry. The question is, I want to ask Dr. Cuevas, is there any nurses who work in social welfare in the Philippines? And what is the difference or the role of the nurses for gerontology in clinic and social welfare?
As of present, our gerontology nurses are the ones who are from the National Center for Geriatric Health, which is the arm of the Department of Health for geriatric care. So we have no specialization currently on gerontology, but the Gerontology Nurse Association of the Philippines provide training and certification programs to be gerontology nurses. Also, gerontology nurses are growing in number because not only of local need, but also of global needs. And so I think there will be more who are interested in being a gerontology nurse.
All right, thank you very much, Dr. Cuevas. Okay, we will entertain questions from our participants. But before that, I would like to acknowledge Sister Gertrudis Berry. Sister Gertrudis Berry, Dean Panaligan from Cavite, Dean Idisa, Ruby Idisa from Butuan Orius University, and Dr. Chua. Okay. Okay, any questions from the floor? Any questions from the floor? Dr. Cuevas, yeah, it's a common practice here in Australia of something like an intergenerational services. And I mean, when you say intergenerational services, they pitch in programs or projects or activities, not only for older adults, but side by side, they offer services for, for children, side by side with the adult services. Is this possible in the Philippine context?
I think it's possible, but it will be a challenge because right now I find an intergenerational gap among our youngers and our older persons. Although it is not impossible because we all know that aging gracefully is a life course perspective. So it means that what you put in when you are younger, you actually gain more when you are older. So seeing younger people seeing their older relatives or their older persons and how to age gracefully will actually help them to age gracefully as well. But unlike in Australia, which is the government has mandate for family-oriented, very, very family-oriented environment, I think in the Philippines, we have to be the ones, our families should be the ones to implement this, having our children and our grandparents together so that our children can actually learn from the wisdom of their grandparents.
All right, thank you very much, Dr. Cuevas. Any questions from our attendees, participants? It looks like we've covered all of our questions, Dr. Cuevas. Is there anything else you wanted to cover up before we wrap up things?
I just want to add to what Mr. Joel Stasio said, that really one of the strengths of the program is interprofessional team collaboration. We acknowledge that it is not all about the nurses, but also the strengths that other interprofessional team brings into the picture. And even in community, hospital, or other settings, it's always the nurse who is the center, who manages everything, who makes the coordinations and communications, and makes sure that everyone brings something to the table. And that's the beauty of having an interprofessional team in an adult daycare program. Also, even if we wanted this to be all government, if we really wanted to have an adult daycare program, this can be a private-public partnership wherein we can make a program and partner with the government for other provisions. Or it can also be private. A nurse can run an adult daycare program and have a business atmosphere with it. No, so actually, I have in my module of training nurses, there is a part there on how to set up your own adult daycare program. So for those who are enterprising and would want this to make a business, this could be an entrepreneurial activity also for nurses who wanted to make this into their own business. And as an offshoot of the research, we realized that music, reminiscence therapy are also important. Sorry. That's it. Thank you for everyone for coming.
Yeah. Finally, before we wrap up, actually, Dr. Idisa just popped in one rejoinder here. A rejoinder statement is, she said, Dr. Idisa is from Orios University, Butuan, and she said, the interventions used in the program relate to the therapies usually conducted by the students during their geriatric nursing exposure. But there were some new interventions which give us new interventions, which we can possibly do during our students' exposure. And we thank you for that, Dr. Cuevas, she said, because we in the nursing education can provide most of those interventions to the older adults, so you can include us in the recommendation. During the geriatric nursing exposure of our students, one of my observations is that some older adults have conflicts with each other. Among those interventions you have made which can contribute harmonious relationship or good camaraderie among them. Okay, so that's from Dean Idisa.
Thank you, Dean. I'm glad that this study will be able to help more of our students and integrate them into their gerontology nursing practice or their programs in the community.
Okay. At this juncture, I would like to inform you that on 7th of May, next week, it's going to be the Filipino Nursing Diaspora Day, and that we will have a webinar on resilience. We have a director from New York Presbyterian Hospital will be our presenter. And on May 9, we'll have another one, a webinar from about mindfulness, and this will be delivered by an expert from a Filipino expert from Nevada. Okay, so I hope you guys will be able to attend in that webinar. These are free webinars on May 7 and May 9. Okay. I would like to thank Beta Nu Delta Nursing Society, Nursing for Humanity, Dr. Cuevas, Professor Joel Stasio, and Dr. Kenneth Beluya for being part of this wonderful webinar. God bless. Thank you very much to all of you.
Thank you. Good afternoon.
Good afternoon.
Thank you.